So today we are discussing about pituitary gland. Pituitary gland, otherwise we can call it as hypophysis cerebri. Pituitary gland, otherwise called it as hypophysis cerebri. Okay. So the pituitary gland, it is situated in the middle cranial fossa. It is situated in the middle cranial fossa on the body of the sphenoid. That fossa we call it as hypophyseal fossa, which is suspended from the floor of the third ventricle by a stalk called infundibulum. Though the pituitary gland, it is suspended from the floor of the third ventricle by a stalk called infundibulum, and this infundibulum, it pierces the dural fold that is called dorsum. It suspends the dural fold called diaphragma sellae. Okay, so the pituitary gland, otherwise called as hypophysis cerebri, it is situated in the hypophyseal fossa and it is suspended from a stalk known as infundibular stalk, and this infundibular stalk pierces the dural fold that is called diaphragma sellae, and the pituitary gland consists of it is divided into two. First one is anterior lobe and next one is posterior lobe. Anterior lobe we can also call it as adenohypophysis or anterior pituitary, and the posterior lobe we call it as neurohypophysis. Posterior lobe we call it as neurohypophysis. So the pituitary gland consists of two lobes, anterior lobe or otherwise called as adenohypophysis, and the posterior lobe we can otherwise called as neurohypophysis. Okay, so the adenohypophysis, coming to the adenohypophysis, it is very cellular. It consists of more number of cells are present in the adenohypophysis. It divides into three parts. The part which is an intragranular cleft is present in the anterior lobe, that is in the adenohypophysis, and the part which is anterior to the intragranular cleft we call it as pars anterior. The part which is anterior to the this is the intraglandular cleft, right? This is the intraglandular cleft. The part which is present anterior to the intraglandular cleft we call it as pars anterior, and the part which is present behind the intraglandular cleft we call it as pars intermedia, and the pars which extends above to the infundibular stalk we call it as pars tuberalis. The pars which is extends above to the infundibulum, which extends above to the infundibulum, we call it as pars tuberalis. So the anterior lobe consists of three parts. The intraglandular cleft present in the anterior lobe divides the gland into pars anterior, which is present in front of the intraglandular cleft, that is pars anterior. The part which is present behind the intraglandular cleft we call it as pars intermedia, and the part which extends above to the infundibular stalk we call it as pars tuberalis. Okay, and coming to the posterior part, the posterior part doesn't consist of any cells except unmyelinated nerve fibers. Unmyelinated nerve fibers are present in the posterior part along with some cells we call it as pituitary. So the posterior part consists of unmyelinated nerve fibers along with some cells we call it as pituitary. The endings of the nerve fibers, we have knob-like terminals are present at the endings. We call it as herring body. We call it as herring bodies are present, are the knob-like terminals present at the end of the unmyelinated nerve fibers. These herring bodies consist of neurosecretory vesicles. Neurosecretory cells are present in the herring bodies. Okay, so first coming to the anterior part. So the anterior part consists of chromophores as well as chromophil cells are present in the anterior part. So the anterior part consists of chromophores as well as chromophils. Okay, so chromophores are occupy the 50%. 50% of the cells are chromophores. So the anterior lobe consists of chromophores as well as chromophils. These chromophils occupies the 50% of the cells of the anterior lobe. These chromophores are inactive cells. They may further develop into chromophils. Chromophil cells again divides into acidophils as well as basophils. Chromophil cells again divides into acidophils and basophils. We note that the pituitary gland is the master gland of the body, because the pituitary gland, it controls the functions of other endocrine glands of the body. It controls the other endocrine glands of the body. That's why we call it as master gland. But in recent studies we came to know that hypothalamus plays an important role, because the pituitary gland, it is under the control of hypothalamus. So we may consider hypothalamus is the master gland of the body. So the pituitary gland itself, it is under the control of hypothalamus. Okay, so usually the pituitary gland, it is the master gland of the body. It controls the functions of other endocrine glands. So coming to the anterior pituitary, we have chromophores and chromophil cells are present, and the chromophil cells are acidophils and basophils. These acidophil cells, so chromophores and chromophils are present. The chromophores are occupies the 50% of the cells of the anterior pituitary. And these chromophore cells, they are inactive cells and they further develop into chromophil cells. They are the basophilic cells and the chromophil cells are the acidophilic cells. Okay, so coming to the chromophil cells again divides into acidophils and basophils. Coming to the acidophil cells. Acidophil cells are further divided into somatotrophs. Acidophils are further divided into somatotrophs as well as mammotrophs. Acidophil cells are further divided into somatotrophs as well as mammotrophs. These somatotrophs, they secrete growth hormone. And these mammotrophs, they secrete prolactin. So the growth hormone, we know that it helps in the growth of the bones. So the growth hormones, they help in the growth of the bone. These somatotrophs, they secrete growth hormones, and the mammotrophs, they secrete prolactin hormone. So what is the function of prolactin? It helps in the ejaculation of milk. When the suckling reflex on the baby suckles the nipples, the suckling reflex causes the mammotroph to release the prolactin, and this prolactin helps in the ejection of milk during suckling reflex. So the prolactin helps in the ejection of milk. Okay. And the growth hormone helps in the growth of the bones of the body. Okay, so acidophils are of two types, somatotrophs and mammotrophs. Somatotrophs secrete growth hormone and mammotrophs secretes prolactin. Okay, so that's about the acidophils. And coming to the basophil cells. Basophil cells are thyrotrophs, corticotrophs, so the basophil cells are thyrotrophs, corticotrophs as well as gonadotrophs. Okay, coming to the thyrotrophs. The thyrotrophs secretes thyroid stimulating hormone. The thyrotrophs secretes thyroid stimulating hormone, which helps in the release, which regulates the colloid to release the T3 and T4 hormones. We know that the thyroid follicles consist in the thyroid. When we take the section of thyroid gland, we have thyroid follicles, and in the thyroid follicles we have iodinated thyroglobulin is present. This iodinated thyroglobulin help in the manufacture of hormones T3 and T4, and the release of T3 and T4, it is under the control of thyroid stimulating hormone. And corticotrophs, they secrete adrenocorticotropic hormones. Adrenocorticotropic hormone, which controls the secretion of the adrenal gland, which controls the secretions of the hormones released by the adrenal gland. We know that various hormones, they released by the adrenal gland. There are glucocorticoids are present, mineralocorticoids are present, and these hormones, they are regulated by the adrenocorticotropic hormone. And coming to the gonadotrophs secrete follicle stimulating hormone, luteinizing hormone in females and interstitial cell stimulating hormone in males. So the gonadotrophs, they cause the secretion of follicle stimulating hormone, which helps in the maturation of the ovarian follicle, as well as in males it helps in the maturation of sperms. During it stimulates the spermatogenesis. In males it stimulates the spermatogenesis, and females it stimulates the oogenesis, which helps in the maturation of ovarian follicles. And the luteinizing hormone after the rupture of the follicle, this luteinizing hormone helps in the development of corpus luteum, and it also secretes progesterone. And interstitial cell leading hormone, which is present in males, which helps in the secretion of testosterone. Okay. So the basophil cells are of three types. Thyrotrophs, corticotrophs, and gonadotrophs. These thyrotrophs, they secrete thyroid stimulating hormone, which controls the thyroid gland and to release the hormones, the T3 and T4 hormones from the thyroglobulin, iodinated thyroglobulin, nothing but the colloid. And the corticotrophs, they release the adrenocorticotropic hormone, ACTH, which controls the secretion hormone released by the adrenal glands. Adrenal glands are situated on the upper part of the kidney. We can also call adrenal glands, otherwise called as suprarenal glands, and these adrenal glands, they secrete glucocorticoids, mineralocorticoids, and the cortex of the adrenal gland secretes glucocorticoids and mineralocorticoids. And coming to the gonad, so the ACTH controls the secretions of the adrenal gland. And coming to the gonadotrophs, they secrete follicle stimulating hormone, and in both males and females, luteinizing hormone in females, and interstitial cell stimulating hormones in males. This follicle stimulating hormone helps in the maturation of the ovarian follicle, to form primordially ovarian follicle to mature ovarian follicle, and it also helps in males in the spermatogenesis. And luteinizing hormone, it helps in the it develops the corpus luteum after the rupturing of the ovarian follicle. It helps in the development of corpus luteum after the rupturing of the ovarian follicle, and also it secretes progesterone. It stimulates the secretion of progesterone. And interstitial cell stimulating hormone in males, it causes the secretion of testosterone. Such about the basophil cells. So eosinophil cells are two types. One is somatotrophs and one is mammotrophs. These somatotrophs secrete growth hormone, and the mammotrophs secretes prolactin hormone. And basophil cells are three types: thyrotrophs, corticotrophs, and gonadotrophs. So the gonadotrophs secrete THS, corticotrophs ACTH, and gonadotrophs secrete follicle stimulating hormone, luteinizing hormone, and interstitial cell stimulating hormone in males, and thyrotrophs secretes thyroid stimulating hormone. And the part intermedia here, it secretes one hormone that is called melanocyte stimulating hormone, which causes the pigmentation of the skin. The pars intermedia secretes melanocyte stimulating hormones. So that's about the anterior pituitary. So the anterior pituitary consists of chromophores and chromophil cells. Among the chromophil cells, we have estrophils and basophils. Okay. So that's about the anterior pituitary. And coming to the posterior pituitary, the posterior pituitary consists of unmyelinated nerve fiber. The posterior pituitary consists of unmyelinated nerve fibers, and the endings of the unmyelinated nerve fibers, we know that this is the unmyelinated nerve fibers, and the endings of the unmyelinated nerve fibers, we have a knob-like structures are present. They are called, the black ones we call the round structures, we call it as herring bodies. These herring body consists of neurosecretory vehicles. Okay. The posterior pituitary does not synthesize any hormones. The posterior pituitary acts as a storage of the hormones, because the supraoptic nuclei, this is the supraoptic nuclei, and this is the paraventricular nuclei. Okay, paraventricular nuclei as well as the supraoptic nuclei. These supraoptic nuclei as well as the paraventricular nuclei present in the hypothalamus. They synthesize hormones, two hormones, those are called vasopressin and oxytocin. The supraoptic nucleus, it involves in the synthesification of the vasopressin hormone, and the paraventricular nuclei, it synthesizes the vasopressin oxytocin hormone. The supraoptic nuclei, so the posterior pituitary does not synthesize any hormone. It acts as a storehouse of the hormones which are released by the hypothalamus. The supraoptic nuclei, is synthesized as the vasopressin. It synthesizes the vasopressin. We can otherwise call it as antidiuretic hormone. And the paraventricular nuclei, it synthesizes the oxytocin hormone. So these two hormones, they are synthesized by the cells of the supraoptic and paraventricular nucleus. They pass along the axon and they are present in the posterior pituitary. So posterior pituitary acts as a storehouse of vasopressin and oxytocin. Okay, so what is the function of vasopressin? Means it causes the absorption of water from the distant convoluted tubule. If the vasopressin is absent, what happens is that we can excrete excessive amount of urine. We can pass excessive amount of urine if the vasopressin hormone is absent, because vasopressin allows the concentrated urine by absorbing water from the distant convoluted tubule. And what is the function of oxytocin? Is it helps in the movements of the uterus during labor times. It helps in the ejection of the fetus during labor time. During labor time, it helps in the ejection of fetus. This is the function of oxytocin. And other function of oxytocin is it helps in the movement of sperms by causing the contractions of the uterus. So that is the function of the oxytocin. The oxytocin, it causes propulsion of uterus and helps in the movement of sperms by inducing movements in the uterus. So that's about the oxytocin. So these are the two hormones secreted by the hypothalamus, by the supraoptic as well as the paraventricular nuclei. Okay, so these hormones are released from the posterior pituitary whenever they are required. It acts as a storehouse. Okay, and coming to the blood supply. When coming to the blood supply of the pituitary gland, the anterior pituitary, it is supplied by the superior hypophyseal artery. This superior hypophyseal artery, by entering into the anterior pituitary, it divides into tuft of capillaries. Okay, it divides into tuft of capillaries. From the tuft of capillaries, again long portal vessel as well as intermediate portal vessels arise, and they again divides into second tuft of capillaries as well as the sinusoidal capillaries. They again divides into sinusoidal plexus as well as the second tuft of capillaries. Here, first what happens is the superior hypophyseal artery is a branch of the internal carotid artery which supplies the anterior lobe or adenohypophysis. It enters the gland and divides into tuft of capillaries. From the tuft of capillaries, again long portal vessel as well as the intermediate portal vessels, they enter the gland and they divide into again second tuft of capillaries or sinusoidal plexus. From the sinusoidal plexus, the veins drain into cavernous sinus as well as the anterior interconnecting cavernous sinuses. And the posterior pituitary, it receives blood from the inferior hypophyseal artery, which is a branch from the internal carotid artery, and this posterior pituitary, it divides into tuft of capillaries. The inferior hypophyseal artery, after entering into the posterior pituitary, divides into tuft of capillaries. From this tuft of capillaries, again the sinusoids drains and they further drain into posterior intercavernous sinus and they drain into cavernous sinuses. So that's about the blood supply. And one more important thing is relations of the pituitary gland. It is related above with the dorsum sellae. It is related above with the optic chiasma, and also it is related above with the that is a dural fold, we call it as a diaphragma cell. Below it is related to the body of the sphenoid and sphenoid air sinuses separated by a plate of bone, and posteriorly we have dorsum cell and posterior clinoid processes are present, and anteriorly we have tuberculum cell as well as the anterior clinoid processes are present. So this is the hypophyseal fossa. So this is the body of the sphenoid, we call it as this one, we call it as hypophyseal fossa. So this is the body of the sphenoid. So and below we have sphenoidal air sinus is present in the sphenoidal bone, and posteriorly it is related to the dorsum cell as well as the posterior clinoid processes. Anteriorly it is related to the tuberculum cell as well as anterior clinoid processes as well as optic chiasma, and above it is related to the dural fold, we call it as the diaphragma cell, which is pierced by the stalk of the pituitary cord infundibulum. So that's about the pituitary gland. So pituitary gland is otherwise called as hypophysis cerebri. In exams we may get the question like hypophysis cerebri. So we should remember that pituitary gland is otherwise called as a hypophysis cerebri. That's about the pituitary gland.